section. 1 second. Okay. I think normally we would have started off. Okay. Oh, so, good evening and good morning to those of us who are joining us from another part of the globe. Welcome to the June 2025 Autism Face Yoga sessions. I'm so happy to see all of you. We have a very interesting guest, but before that, of course, we will do our face yoga capsule. Today's topic is autism, face yoga, and motor disturbances in autism. So I'm going to welcome our guest for today, Dr. Shiwangi Potnis. She's already here and she's got such a lovely beaming smile. I will introduce her shortly. Before that, let's complete our capsule. Dr. Shivangi, you're most welcome to join us in our face yoga capsule.
Thank
I
you.
give
Thank
that
you
to
so
you,
much.
and maybe you can connect it with neuro physiotherapy. That would be wonderful. Okay, so face yoga technique is for beauty, wellness, neuro conditions, autism, ALS, sorry, facial paralysis, facial palsy, first line dementia, and so forth. Face yoga is a series of asanas or exercises that focus on the 57 facial muscles of the face, the neck, and the scalp. Scientific, sequential format. Of course, the format is tailored depending on what is the requirement. Is it wellness? Is it autism? Is it swallowing with respect to neuro conditions? And the entire capsule is tailored as per the requirement. It is observed that when these muscles are exercised, the 57 facial muscles, it stimulates the central nervous system, the brain, and the endocrine glands, increasing blood circulation to the face, the neck, and the scalp.
हाथ पे करो
Please,
एप्पल का करो i3 या i5 या i
hello. Could you please get off the Zoom link ideally and go onto the Facebook, please? Okay. It was observed that when these muscles are exercised, as I mentioned, 57 facial muscles, they increase blood circulation. So, with blood circulation, you're talking about oxygenation, nutrition, and chi or ki or pran shakti, as we call it, or just universal life force. Face yoga is for everyone on the autism spectrum, caregivers, family, and friends. So, with this, let's move on to our capsule, our face yoga capsule. Yes. So, how do we say it the face yoga way? Yes, right? So, how do we say it the face yoga way? Get ready, smile, and yes, stretch, hold, and relax. We've been together for quite a while. Most of you know how to max this. So, get ready, breathe in, breathe out, and stretching. Yes. And hold, and hold, and hold, and relax. And of course, tapping. Tap cheeks, the chin, the buccinator, the zygomatic, the orbicular oris, sorry, the oculi and the oris, and relax. Let's get it right. Some of us need help. So, how do we do that? Take the fingers or your fingers, place them, place them at the corners of the mouth, and then ask them to say yes. Get ready, breathe in. Yes, stretch the fingers. Yes, ask them to say yes, 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 and hold. Breathe in, breathe out. Breathe in, breathe out. Hold the position and relax. And tap. Tap their face, ask them to tap their face. Let's do it one more time. Take the fingers or take your fingers, place them at the corner of your mouth, and get ready to stretch. Ask them to say yes, yes, stretch, stretch, stretch. Hold the position. Doing good. Excellent. And relax. Yeah. Tap. Okay. Get ready. I want to do the nose crunch. Do you remember the rabbit? What does he do? One, two. Okay. So get ready. We're going to do 5 crunches. Look straight, relax, and stretch. Crunch. Hold, hold, and relax. Excellent. Excellent. Breathe in, breathe out. Again, get ready and scrunch. Hold the position. Excellent. Hold, 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 and relax. Tap, tap. Okay. If somebody needs help, just ask them to pick this funny nose and relax. If they can't do it very well, that's fine. Take their fingers and ask them to just push up and hold the position and relax. Tap. Quickly, 3 more. Get ready and scratch. Hold the position. 1, 2, 3, 4, 5. Relax. Tap. 2 more to go. Get ready and scrunch. 1, 2, 3, 4, 5. And relax. Scrunch. Scrunch. One more time. Get ready and very good. 1, 2, 3, 4, 5. And relax. Good job. Very good job. Good job done. Breathe in, breathe out. What I want you to do now is open your mouth and fold the upper lip in onto your teeth. So get ready. Ah, fold and hold. 1, 2, 3, and relax. Very good. You're doing good. Excellent. Get ready. Open your mouth, fold your lower lip in, hold the position, and relax. Good job. Somebody needs help? It's very simple. Take their fingers or ask them to open their mouth, fold their lip onto their teeth. Hold that position for them and count to 5. And relax. Very good. Good job. Good job. One more. Take their fingers, or just ask them to open their mouth and fold their upper lip tightly and hold the position and relax. Tap, gently tap, tap around the orbicular oris, the sides, on the eyes, the frontalis, temporalis, side. Excellent. Okay. Now, what I need to do, we are going together for the lower lip. Similarly, ah, fold the lower lip inwards onto your teeth. Yes? Let's do it again. Ah, fold the lower lip and relax. Good job. Very good. Tapping quickly. Tapping. Again, if somebody needs help, it's very simple. Take their fingers or ask them to just make a O, fold their lower lip onto their teeth and hold that position. And relax. Very good. Good job. Tap one last time. I want you to open your mouth, take their fingers or just fold, hold the position and relax. Tap. Very good. Good job. So, the next, let's work on the orbicular oris. Raise your eyebrows and look up to the ceiling. Stretch. Eyeballs looking up. Hold the position and hold. And 3. Stretch a little more. 4, 5, and relax. Tapping. Very good. Again, get ready. Stretch your eyebrows. Look up. Hold the position. Eyeballs looking upwards. And 1. And 2. Stretch a little more. 4. And relax. Good. Good job. And tap. Okay. Next, what I want to do is remember the scary eyes. I want you to sort of have your eyeballs staring straight ahead into the screen like this. Can we do that? We can. Get ready. Pull them out. Okay. I want you to feel all those muscles around your eyeballs. Hold the position. Very good. 2, 3, little bit more. 4, 5. And tap. Again, let's do it a little better. Look straight. Pull out your eyeballs. Hold the position. 1, 2, 3. Some of us will feel an entire tightening of a band around your head moving towards the bulbar region. And that's exactly what we want to activate. Relax. Breathe in, breathe out. Breathe in, breathe out. Get ready. What do we do? Stretch, look out, hold the position. 1, 2, 3, 4, 5. Relax. Tap. Excellent. Good job done. And relax. Okay, now let's wind up with the balloon. So, those of us who just joined us for the first time, I want you to take in air, fill your entire cheeks. Let's do it again properly. Fill your cheeks with air. Hold the position and smile. And one, and two, and three, and four, and relax. Good job. Tapping. Okay, get ready. Let's do it better. Smile. Five, and relax. Tapping. Very good. Good job done. And with this, we're going to wind up for today, and we're going to listen to our guest, Dr. Shiwangi Potnis. I'm looking forward to hearing about her. But before that, we will, I'd like to have a quick introduction of Shivangi. Thank you so much for joining us today.
Hi.
Hi. So we're looking forward. I'd like to just introduce you. Shivangi has a master's of physiotherapy. Neurosciences is her specialization. So that's really interesting. And that's exactly what's got my interest even more. She has an experience in clinical and academic experience, neurophysiotherapy. She's an additional professor at Surya Datta Institute of Health Sciences, College of Physiotherapy in Pune, which is, I think, amazing.
Yes.
Okay, so before I hand over to you, I made a note. So it says to myself that I'd like to read it out to you. Neuroscience physiotherapy is also neurological physiotherapy. Uh, is a specialized area of physiotherapy that focuses on treating individuals with neurological conditions, right?
Yeah.
So when I read that, the thoughts in my mind were, and it would be nice if you could sink it in, was so how does neuro or physiotherapy help autistic kids or those on the autistic spectrum? And is it necessary? So I'm going to hand over the platform to you, and we're looking forward to hearing your expertise and your perception on the same. Thanks,
Yeah.
Shivangi.
Thank you.
Yeah.
Am I audible? Yeah. So I have made a short PPT to make it more understanding visually as well, because when I'll speak a bit faster, maybe everyone will
No,
not.
no, I'm sure. So I think there is a screen sharing has been shared with you.
Yeah, I think
Yeah.
it.
So go ahead. Go ahead then.
Yeah. So I think you can see my screen now. Yeah. Can we all see my screen?
No, not yet. I don't think so.
Hmm.
Let's just try this. Screen share. Yeah, now we can.
Okay. Yeah. So today we are all going to talk a bit about the motor disturbances that we see in autism spectrum disorder, and especially the question that you asked for. So first of all, uh, I think we all know that there is a high prevalence of motor difficulties in ASD. So according to the prevalence studies done by the researchers, it says that 79 to 87% of the kids who are on the autism spectrum have a motor difficulty, and they have a high prevalence, if maybe not early on in age, they have a high prevalence of developing it in future. So what are the early manifestations of these motor difficulties? We are going to see more on that. So it can be as simple as an example, per se, say reduced arm movements in the first month of the child, or maybe say head control is not available by 4 months and it is not developed well. then maybe say delay in walking. There are also chances of losing balance while walking in around 14 months, when a normal child is supposed to achieve walking, but is not able to for some reason. And then what are the predictive signs that we see? So these motor delays show signs like hypotonia. So basically we have a tone in the muscle which is regulated by our brain, that is your central nervous system. And because of there are some abnormalities, or there is some deficits in the brain development of that child on the spectrum, it results in, decreased muscle tone. And usually when the baby is very small on an onset, so we do not see the muscle tone as such, because the muscle tone is flappy, the baby just tries to move and rolls around and all that. But then slowly and gradually, as we are doing arm movements with around 1 month, and head control comes around 4 months, so these certain characteristics or motor development that has to happen in a certain milestone does not happen. That can be one of the cause, can be low muscle tone. So we have to get it checked by our pediatricians, neuropediatricians. There are specialized doctors for that. You can also visit a neurophysiotherapist, any pediatric physiotherapist per se. So these are prodromal signs which help in early detection. Now, why are early detection important? So because these motor difficulties are again bifurcated on the basis of gross motor skills, fine motor skills, and there are some stereotypical motor behaviors that a ASD child learns over a period of time. So gross motor skills usually consist of the whole bodily movements, not only hand, not only lower limb, the whole body. So as we know that walking requires the whole body movement, there is a whole body movement coordination, postural control involved. So walking, that is your gait. A bilateral coordination, like movements of left and right hands in sequence and at a particular time. So that requires a lot of planning and motor execution in your brain. Then postural controls, like maybe say balancing or posture. So as simple as a child is able to sit without support or not. So that requires a lot of postural control. Your trunk muscles are involved, your back muscles are involved. So basically these are all gross motor skills that are required to develop over a period of time in a child. Coming to fine motor skills, so if you see that there is any trouble in manipulating certain objects, like maybe say lock and key or opening a bottle, so all these are fine motor skills which require your hand movements, your finger movements. So these are precise movements, it requires accuracy, it requires precision. So when such movements are hampered, you will see fine motor skill affection. Then maybe handwriting difficulties for a over a period of time the child develops handwriting difficulties, or maybe not able to draw a line, not able to draw a circle in a coordinated way. So all these are basic difficulties that we see early on in age, and if it progresses, then it leads to further more difficulties. So there are stereotypic movements like head banging. A child, ASD spectrum child, has a habit of head banging if his certain needs or his behavior is not met, or his demand is not met per se. Then hand flapping. They have a habit of repeating movements. So that is a very common thing that we see in such children. So these repetitive restrictive behaviors are also a part of motor stereotypies that we see in a ASD child. So yes, so now we have an overview of the motor difficulties that we usually see. So these Now, what will happen if these motor difficulties are seen in a child early on? So it will impact its daily, day-to-day living activities, because everything requires, like, for example, dressing, eating, personal grooming habits. All this requires a lot of motor movements that has to be coordinated by your brain and your, body, hands and legs and everything. So first of all, day-to-day living activities will be hampered. Then second, the academic performance will be hampered. Like, for example, we talked about fine motor skills, so it affects your handwriting. So your academic performance will be hampered. The teachers in the school will complain that your child does not write well in a, in a given format or in a given line. So these are certain difficulties where you can help. Like, if a teacher complains about these and you see other factors as well, you can have an early detection test, and you can actually help the child, get better and recover faster, because prevention is always better. So, and yeah, so once a child grows, he is in a peer, and they have, in play groups also, in schools also, they practice extra co-curricular activities. So in sports, if maybe say it's just an obstacle race or something, and the child is not able to jump on both the feet, so maybe there is a gross motor difficulty. So we have to think about those terms also. So what will happen is this: all your ADLs, your participation, your academic performance is getting hampered. And then, of course, if a child is facing all these issues, there will be some impact on the social and cognitive aspect of the child. Okay, the child will not feel emotionally developed or socially developed according to the surrounding peer that he is in. Okay, maybe say everyone is not lucky enough to go to a special school. So if the child is actually suffering through all these motor difficulties, small things, uh, th- and the child is not diagnosed well, what will happen is, the child goes through a lot of emotional and social disturbances in the school environment, in the peer, saying that I am not normal, or maybe I'm not able to do these things as well as you are able to do, or a normal child is able to do. So that awareness is very, very important for all the parents and all the relatives or all the caregivers who are actually in and around a child who face such motor skill issues. Not every child is the same, so we need to know about these things. So the awareness is my part that I'm trying to do right now. Then coming to, yes, potential of early intervention. So if we know these things are a part of ASD spectrum, or maybe say autism, then if we are vigilant enough, we are alert enough to see these signs as a parent or as a caregiver or as a person who is associated with a child somehow, or even teachers should know these things. So if we are associated with children and we can see such signs, we should refer them to further assessments, further pediatricians, or maybe say neurophysiotherapist or pediatric physiotherapist, and so that a detailed assessment is done on those skills. And then we can, we have therapies for each and every motor difficulty that we just discussed. So therapies actually help. Like, for example, Meenal ma'am can help with speech difficulties, communication, right? That also requires a motor skill when you are involving on the facial muscles. Similarly, there are other muscles in your body that can be affected. So we need to early on diagnose, so that the child does not face any social engagement issues, any cognitive development is not hampered, And with therapies, with constant therapies, and an approach of recovery, the child also feels normal, the child also feels special, and there will be certain special abilities that we can build on in that child. So every child is special is the thought behind this. And we all should, as an educator, as a parent, as a caregiver, we all should know about these things. Then why does this happen? So the normal question is, why do ASD people have motor difficulties? It is because of mainly four things that we can distinguish into. The primary thing is, there is a part of brain called cerebellum, which controls all this motor movements, be it fine, be it gross motor skills. So somewhere the cerebellum is not developed, or maybe there is a part which is affected in the cerebellum. So that is why this motor difficulties can result. Not necessarily cerebellum being affected, but one of the reasons. Second is, there is connectivity issue. So since we know that we have special senses in our body, like eyes, ears, taste, nose, right? So these special senses have a connection to different regions of our brain. So when these connections are not developed properly, or maybe there is a connectivity issue, like sometimes we go off the Wi-Fi because of some connectivity issue. Similarly, there are connectivity issues in our brain and our special senses also. So if that is not coordinated well, that can result in these motor disturbances. Then maybe say genetic factors. Not every time a genetic factor is present, but yes, certain times certain gene mutations happen. We know that gene mutations happen because we are in a phenomena of evolution. So gene mutations happen over a period of time, and certain mutations are just the sequence of the DNA are just predisposed to certain spectrum like conditions. So yes, genetic factors can be, because researchers have said that ASD and autism may or may not have genetic factors included. Then coming to sensory integration difficulties. So we all know that our touch, our senses are a part of our sensory system, and motor system involves the movements and everything. So only when we can sense that something is going wrong can we react to it or respond to it, right? So when these sensations are not integrated well, the signals do not reach the brain, and then the motor movement that is supposed to be produced is not produced enough, or maybe say not in a coordinated way or a smooth way, right? So like for example, if I touch a hot object, I know it is hot because my touch sensations are active, and they are able to gauge that, oh, this is hot, I have to take my hand away, right? So
Absolutely.
this
Yeah.
is a motor movement, and our sensory system is gauging whether the temperature is hot or cold. So these sensory disturbances can lead to motor difficulties as well, right? So this was just a small example.
Mhm.
Similarly, in a child, if he's walking on stones and the child is not able to feel the texture or the hardness or the firmness of the stones, the child will step on it and the child will lose balance, but the child will not understand whether it is a stone or the differentiation between textures. So that means that his sensory integration is somewhere gone for a toss, and there are sensory integration difficulties which need to be addressed to promote motor recovery. Yeah, so this is the causes. Coming to the milestones that have to be achieved, 1 month, if we see that a child has reduced its arm movements, so this is an indicator of a subtle indicator of motor disturbances being occurring in the future. So we have to take care from early on. If still not, then 4 months around, there is a lack of head control, if you see a child is not able to control his head in, in an extension position, that means that this is a sign of motor difficulty. Again, there is a decreased strength and the stability is not there, not developed. So we need to address it. If not, then it will progress to 14 months where there will be delay in walking. Say the child is not able to walk or not able to step, or maybe not able to walk without support. Yeah. So yes, that means that there can be a case where we see the muscle tone has reduced, the regulation of the brain has gone for a toss, and the muscle tone is reduced in the legs, and that can lead to delay in walking. Okay, so muscle tone and strength are two different things. That is, if we go into it, it's a separate topic. But for our understanding, we should know that there is a factor of muscle which is controlled by our brain. So if that is not well controlled because of the brain development not happening at par, that can lead to reduced tone. Then over a period of time, if preschool age, you see the child is very clumsy, he's banging and hitting on different doors, he's losing balance while walking, he does not understand left and right, he is not able to coordinate eye and hand, he's not able to maybe say catch a ball, right? Or maybe he's not able to jump with both his legs at the same time. So these are certain changes that you see in a preschool age, and that can be detected as motor difficulties. Then progressing to school age, there are handwriting difficulties, difficulty in participation in any sports activity, the academic performance is hampered, there are stereotypic movement like banging of head. If if a child feels rejected or feels that someone has scolded him for something, he's not able to socially understand that, and the child shows such motor behaviors of flapping a hand and getting angry or rolling his sleeves or clothes. So these repetitive movements also show that there is certain motor disturbances resulting because of ASD or autism spectrum. So now we were only talking about the problems. We'll come to the solution. So the solution is, there are therapies like physiotherapy, occupational therapy, sensory integration therapy. There are sensory integration experts available in the market. So what does physiotherapy do? So us as physiotherapists, we focus on moreover on our gross motor skills like balance, gait training, walking training, coordination, postural controls, building strength of the muscles that are required for gross motor skills. So those things are under the domain of physiotherapy. So by exercises, by different playful activities, we engage the child in doing that therapy and gaining a kind of maybe say muscle strength or maybe improvement in coordination or balance through those playful therapies. So that is a part of physiotherapy. Then what does occupational therapy do? It focuses more on fine motor skills, manual dexterity, day-to-day living activities. So they will make a playful way method of practicing the day-to-day living activities, make it more interesting. How to improve handwriting, which requires a lot of hand muscles that has to be working in a coordinated way. Then sensory integration, as I told you, sensory information is not being processed. So we sensory integration therapists basically focus on moreover on the sensory aspect. They will add textures, ask the child to recognize different textures in a playful therapeutic way, and integrate the sensory and the motor system. So these therapeutic approaches that I feel for a ASD spectrum or an autism kid is not one but a multidisciplinary approach. Everyone has to work together for the child to improve. Okay, because not one thing will always, improve the overall ability of the child. Everyone has to work in sync. Everyone has to work, have a goal of helping the child. Only then we will be able to address these motor difficulties in the child and reintegrate that child into the social environment, so that he or she is capable of, showing, going around in social activities, participating in extracurricular activities, going to schools, or maybe say play schools. So it is a multidisciplinary approach, and it has to be tailor made for each and every child, because each child shows its own special characteristic. We cannot generalize. So yes, and with this 100% holistic approach and first year of early onset, if we diagnose, we will be able to, help the autism parents or autism spectrum child to, go back to the society, be vocational, be able to survive in the society. And we will be able to accept these children, because every child has a special ability. And we just need to understand that special ability, and we need to help the child gain those special abilities. That is what I believe as a neuropediatric physiotherapist. So I request all the parents to understand these things, and not, scold the child, or why are you walking like that, or why are you falling while you're walking. Maybe the child is actually facing certain difficulties that he is not able to, tell you. So
Absolutely, absolutely. You know what? If we can stop screen sharing, so both of us can then have
yes,
a window. But very nicely put, from the heart. Especially, you've touched the factor about awareness, because today I think awareness has become a very important factor.
yes,
What is the problem? Why is he doing this? And awareness in totality, you said not just caregivers, but friends, family, and the external.
everything.
Yeah.
Yeah,
So
yeah.
I think when you're doing physiotherapy, you're also trying to correlate with society,
Yes, yes.
right? It's a slightly different approach.
Because ultimately the child that comes to you, he comes to you for maybe say half an hour or 1 hour, but after that he's in that society, he's in that family.
Right.
And how people react to towards that child develops his cognitive abilities, and the emotional part of it.
The emotion, right? Huh.
And when a child is not able to perform or not able to do a certain task efficiently, the child also gets affected by all this. So we as therapists have to understand that.
Correct. Especially was, the aggressiveness. I think that can be toned down with more of this
Yes,
approach.
yes, yes.
I mean,
So
the
when
parents and
you,
caregivers are doing it. It's
yeah,
not,
yeah,
yeah.
yeah. And when you do that in a playful way, the child will also not feel that we are doing some exercises or some therapy,
Right,
right?
right, right.
So that will just engage the child more. The energies are, channelized in a better way, and that will help the child recover.
Okay, wonderful. So it's not just the physical. You all are now going, I think, 3 steps forward and trying to engage it from a neurological or a neuro process.
Yes.
So in the olden days was just physiotherapy. Now we're looking at another different subset under the same umbrella. Am I right? Would that be correct
Yes.
for a woman's
We have to consider the sociological and psychological aspects as well. So
it's not just physiotherapy, which is physical. No, it's much more.
yeah.
Wonderful. So Shivangi, it was really nice. We've extended our time, but that's fine. But I love the way you've put it together. I mean, everybody knows about autism, but there's a different aspect to it, which you again brought back, and those who've forgotten about it, again, you brought us back to the starting of the pathway.
Yeah.
So we're looking forward to seeing you again, and sharing more of your experience. And till then, we're going to have to say goodbye to you, and thank you for joining us.
It was great. I felt very like I'm very thankful to you to
No, no,
invite
no.
me in your capsule.
It just happens. It's beautiful. The neurological aspect just caught me, and then we've been having a conversation, and it's nice. But we're looking forward to having you back with us.
Yes, sure.
Okay, so we're gonna say goodbye. Thank you so much.
Thank
Bye.
you. Thank you so much.